left middle position, and I'm gonna roll it towards the tendon. I'm actually gonna use my nail and push the tendon away a little bit, and I'm searching not on the radial artery, I'm searching between the radial artery and the tendon for something to come hit my finger. It should be absent, you shouldn't feel something, but if you feel something here hitting your finger and it's gonna hit you like right next to the nail, that's what's called a ulnar engorgement, a liver ulnar engorgement, okay? Liver ulnar engorgements are, again, more liver blood stagnation in anatomical parts of the liver that are more closely associated to the midline. I have associated this over many years with people who have a lot of liver invading stomach signs. When that pulse is very prominent, it's usually an active process. When the pulse is sort of like faint, it's usually just a chronic, someone tends towards it, but it may not be experiencing it in the moment. So they have a history of it, and then maybe it's like subsided and it can come back and forth and they're more vulnerable to it. So then from here, we just feel the 3 positions, chi, blood, and organ depth of the liver, okay? And then we're gonna move the wrist a little bit, and we're gonna take this middle finger and we're gonna stand it up, and then we're gonna roll it all the way down along the side of the radial artery, and we're gonna be using the ulnar side of the distal phalange joint of the middle finger. When we're looking at this particular, we're also trying to find as the medial part of the vessel, okay? And we're looking for the qualities here, and this is the gallbladder, okay? So the actual anatomical gallbladder itself. And so we can thin, tight, choppy, pounding, slippery, right? You know, very common. Choppy would be a sign of blood stasis, typically a sign of gallstones, okay? Muffling, a lot of muffling here is a sign of like impairment of gallbladder functioning, generally. Especially if there's lots of intensity changes, right?
What if the gallbladder is removed?
Pulse will still be here. Yeah, you're gonna find different, you'll find more muffling, you'll find more stasis from scar tissue and other things that came about from the surgical intervention. Yeah, okay.
Are you talking about the muffling, is that just the physical gallbladder organ function, or also?
Well, it has
psycho-emotional.
Yeah, all of it, yeah. Interestingly, I have correlated quite a lot of gallbladder issues and people who have had, you know, you might find a lot of like issues specifically with being able, like courage, standing up for oneself, being able to like implement change and things like that, being active and engaged and driven, all those show up with the actual pulse. It's very common to see like tense and slippery here. It's like, you know, what Dr. Hammer always called the American gallbladder, you know, so. Okay, so from here, then we're gonna feel the left proximal kidney, right? Kidney yin generally. So we'll do all 3 positions. From here, we're gonna stand the finger up and we're gonna roll inwards. Watch how I anchor. We don't just wanna like, you know, float around here. So we stand it up, we roll it, and index finger rests on the base of the thumb to create an anchor. So now I can search for the large intestine position, okay? I stand it back up, I roll it this way, proximally. Just like I did with the middle position to find the gallbladder, here I'm finding the pelvic lower body position, okay? And that's the left. Did I miss anything? No. And then we would do the exact same thing on the right, except that there's a few less positions on the right side because the heart